Nearly half of all major strokes are preceded by warning signs in the days before they hit. Yet most people miss them entirely. Today, we are walking through 5 critical signals your body may send in the 24 hours before a stroke, from subtle changes you would never suspect to urgent red flags demanding immediate action. Recognizing even one could save your life. Let's start with the sign people overlook most. Number 1. Sudden, overwhelming fatigue stands out as the most overlooked warning in the day before a stroke. This is not the usual tiredness after a long day or a poor night's sleep. It is a wave of exhaustion that can strike without warning, often described by patients as feeling dead tired or unable to get out of bed even after rest. In the Oxford Vascular Study, nearly half of all major strokes were preceded by a warning event, and fatigue was one of the most frequently missed prodromal symptoms, especially among older women. Many dismiss it as a side effect of medication, aging, or a mild illness like the flu. But research shows that this kind of fatigue, when it appears suddenly and does not improve with rest, may signal a brief, reversible blockage in blood flow to the brain, a transient ischemic attack or TIA. The risk of a disabling stroke is highest in the first 24 hours after such a warning. Survivor accounts echo this pattern. Marjorie, age 71, wrote in her diary about an overwhelming tiredness the night before her stroke, only realizing its significance later. For seniors, especially women, paying attention to a sudden, unexplained drop in energy can be life-saving. If this symptom appears out of nowhere, especially with other changes, it is time to call emergency services, not just rest and wait. In second place, sudden confusion or brief episodes of brain fog often signal a critical warning in the hours before a stroke. This is not the slow memory sleep that comes with aging or a momentary distraction. Instead, it is an abrupt sense of disorientation, with difficulty following a conversation, forgetting familiar names, or feeling mentally off for a few minutes. Research from the Oxford Vascular Study and the American Stroke Association shows that nearly 1/3 of older adults who experience a major stroke report some form of confusion or altered awareness in the preceding day. These episodes are especially common in women and are frequently mistaken for medication side effects, dehydration, or early dementia. But the sudden onset and rapid fluctuations set them apart from chronic memory problems. Medical guidelines highlight the delirium, acute confusion, that appears over hours, not weeks, should always be treated as a medical emergency, especially if it comes with other neurological changes like weakness or speech difficulty. In many cases, this confusion reflects a transient ischemic attack, a temporary disruption of blood flow to the brain. If ignored, the risk of a major stroke rises sharply within the next 24 hours. Seniors and caregivers should be alert to any sudden mental cloudiness that feels unusual or out of character. When confusion appears quickly and does not resolve, it is time to seek emergency care, not just wait and see if it passes. Number 3 on our list, brief speech trouble or word-finding difficulty often emerges in the hours before a stroke. This isn't the slow, occasional struggle to recall a name or the mild slurring after a glass of wine. Instead, it is a sudden stumble. Words come out garbled, sentences trail off, or a familiar phrase simply will not form. In the Oxford Vascular Study, about 1 in 5 patients who suffered a major stroke reported a fleeting episode of slurred speech or language trouble in the previous day. These episodes can last just a few minutes and often resolve before anyone else notices. Many people shrug them off as dehydration or a moment of distraction. Yet, research shows that even a single, short-lived episode of speech difficulty can signal a transient ischemic attack, a warning that a major stroke could strike within hours. For older adults, especially those with high blood pressure or heart disease, this kind of speech change is a red flag. Survivor Thomas, age 68, recalls his wife texting that he sounded slurred and asking if he was okay. He brushed it off and then suffered a stroke later that day. Medical guidelines stress that any sudden change in speech, even if it improves quickly, should prompt an immediate call to emergency services. Quick action can make the difference between a full recovery and lasting disability. When speech slips suddenly and without reason, it is time to treat it as a medical emergency, not just a passing lapse. Number 4 on our list, sudden heaviness or weakness in an arm or leg can quietly signal danger in the hours before a stroke. This isn't the sort of tired muscle you get after gardening or carrying groceries. Instead, it's a strange, almost weighty sensation, sometimes described as if the limb is asleep or wrapped in lead. The feeling may last only a few minutes and then fade, making it easy to dismiss as a pinched nerve or simple fatigue. In the Oxford Vascular Study, about 1 in 5 seniors who suffered a major stroke reported a fleeting heaviness or weakness in a single limb the day before the event. This warning is especially easy to overlook because it often vanishes before anyone else notices. Yet research shows that even a brief episode like this can represent a transient ischemic attack, a temporary blockage of blood flow to the brain. The risk of a major stroke rises sharply in the first 24 hours after such a warning. Dawn Turnage, age 73, recalls feeling a strange heaviness in her right arm while gardening, thinking a quick stretch would solve it. 6 hours later, she experienced a full stroke. For seniors, especially those with high blood pressure or heart disease, any sudden unexplained weakness or heaviness in an arm or leg should be treated as a medical emergency. If this symptom appears and then resolves, don't wait for it to return. Call emergency services right away. Acting quickly can prevent lasting disability and save lives. Number 5. Sudden numbness or tingling, often described as a pins and needles sensation, can quietly appear in the hours before a stroke and is frequently dismissed as harmless. This is not the mild tingling that follows sitting in one position for too long. Instead, it is a sudden onset of numbness or a prickling feeling, usually in the face, arm or leg, and often on just one side of the body. According to population-based studies like the Oxford Vascular Study, about 1 in 10 stroke patients reported a brief episode of numbness or tingling the day before their event. These episodes typically last just minutes and may resolve on their own, leading many to believe it is a minor nerve issue or simply a limb falling asleep. Yet, these fleeting sensory changes can signal a transient ischemic attack, a temporary blockage of blood flow to the brain. The risk of a disabling stroke rises sharply within the next 24 hours after such a warning. Older adults, especially those with diabetes or high blood pressure, should be particularly alert to any sudden, unexplained numbness or tingling, even if it goes away quickly. Medical guidelines stress that sensory symptoms appearing out of nowhere without an obvious cause should be treated as a medical emergency. When this kind of numbness or tingling strikes, it is time to call emergency services, not just wait for it to pass. Early action can prevent permanent brain injury and preserve independence. Across every warning sign, one pattern stands out. Strokes rarely strike without a signal. The real danger is ignoring small changes our bodies share. Quick action within that critical 24-hour window saves lives. Staying alert and responding fast truly is the best protection we have.